was something Dr. Sidibe mentioned just before he left. And I believe that's probably the crux of why we're here. Dr. Sidibe, in fact, highlighted that the future of Africa lies with its adolescents. The future of Africa lies with its adolescent population. He referred to that population as the second decade age group. I put that in a technical term, ladies and gentlemen. A third of the economic growth in this area was due to their movement in terms of their demographic transition. A third of the economic growth was because of what they were able to do. If you look at African countries today, we are not doing well in terms of our demographic transition. And the possibility of reaping a demographic dividend is fast disappearing. In fact, for Nigeria, of a country of 214 million people, we are so delayed in our demographic transition, we are referred to as a pre-dividend country. There are some countries that are making progress, Ethiopia, Rwanda, Ghana. They are early dividend countries because their total fertility rate is below 4. Nigeria is 5.3. What are those things you need to do to make progress quickly? You need to provide family planning services, maternal and child health services. Girls need to go to school. You need to empower women. As basic as those things are, they're not delivered at scale, they're not publicly financed enough, and so services are not delivered. So in fact, economic growth might be stalled. And that's why this discussion is important. How do we take to scale maternal child health? How do we expand family planning coverage? And also empower women so that they can have autonomy and be empowered to access health services. And I give a couple of examples. First is, and that's a big point I want to make here, it's good that we have philanthropists and private equity firms ready to put financing on the table. That's great. It's a sufficient, it's not a necessary condition. The necessary condition is the public finance that the governments of countries put on the table. Without that, every other thing we're talking about is poetry. And I would like to just round up with some optimism or optimistic position. First is to say, and I use the example of Nigeria where I work. So the government of Nigeria has committed 1% of the consolidated revenue fund to basic primary health care, for the basic health care provision fund, which is a good initiative, great, and it provides opportunity for private sector partners around the table and on the call to see how has they ever done such public financing. A second one, which speaks to the focus of this meeting, is a cancer health fund. And that also gives an example of how the private sector and public sector can work collaboratively. In fact, through the financing provided by the World Bank and IFC, we got a couple of private sector partners together. We designed the Cancer Health Fund, and the government of Nigeria put money into it, which is contributing to the It's important because that fund prioritizes accessing care to the three commonest cancers, prostate, cervix, and breast. Women, unfortunately, today are burdened by double burden of disease, and the poor are not left out of that. The third point to say, and I think it's important that we're able to have our colleagues of the Sovereign Wealth Fund in the room, because if you look at cancer care now, the government of Nigeria has the Cancer Health Fund, which allows the poor and vulnerable people to access care and reduce out-of-pocket payments, and have the Sovereign Wealth Fund making investments on the supply side of things, making the equipment available and all that. It then means that, one, you have partners who can invest either through some blended financing opportunity with the Sovereign Wealth Fund. You have on the Cancer Health Fund, philanthropists who can put money, to allow more women access that care. And third is, of course, opportunities always are available with institutions like the World Bank, where I work for, and such concessional financing is always available to governments to expand basic care. Thank you very much.